Well, over the years, there's been a number of technological advances, and one of the most significant is pre-implantation genetic diagnosis and screening. Essentially, it allows us to look at the chromosomes within inside the embryo. It helps us select the best embryos for transfer and gives us a much better chance at having a successful IVF cycle. But it can also detect single gene diseases, things like cystic fibrosis, Tay-Sachs, sickle cell disease. So pre-implantation genetic screening allows us to test an embryo regarding the number of chromosomes that are inside that embryo. From this technology, we can eliminate things like Down syndrome. We can eliminate embryos that have extra or missing chromosomes. Frequently, the cause of a miscarriage is a genetic abnormality within the embryo. So being able to eliminate genetically abnormal embryos may help achieve a successful pregnancy under the right conditions. And also, couples are starting to use it now for family balancing, which is basically being able to choose the gender of their child. Pre-implantation genetic diagnosis is a little bit different. With that, we're looking at very specific genetic diseases. We can currently test for over 600 diseases. So it gives us the ability to help eliminate significant medical complications for children in the future. Also, most patients don't realize they may be a carrier of a specific genetic disease. So it's potentially something that really should be considered for all patients. Patients just need to be careful where they're selecting their care. The technology has changed significantly over the past decade. There's still some technologies that only test for a limited number of chromosomes, and those are really not going to give a complete view of the embryo and the health of that embryo. So it's going to be important that the patients be very careful in choosing a clinic that does these tests frequently, that partners with the best labs in the country in order to maximize the chance of success in their outcomes.